Pet dental care. Whoa, what a big subject. I mean, let's face the fact. We all know that a healthy mouth is the gateway to a healthy body. We know that. We know that for ourselves, and we know that for our pets. The question is, are you doing too much? Are you doing too little? I mean, the truth is, there's so much to do. There's so many big questions out there. Putting my cat or my dog under anesthesia for dental cleaning, anesthesia, if maybe if you're like me, that's a big word. It's like I'm worried. Is it safe? Should I do it? And am I at the right place doing it? Well, there's a lot of question when it comes to pet dental care. And we know a lot of great, smart people that know this subject really well. And one special guest is with us today, and that is Benita Altier. She is amazing around the subject. She is a veterinary technician that specializes in dentistry. And I got to tell you, there's not many of them in the world. There's less than 100 certified veterinary technician dentists focused. And she's one of them. She's going to show us all the ins and outs, all of the big questions that you may have, really understanding what pet dental care is about. And are you doing too much? Are you doing too little? You're going to want the show notes. And all you have to do, as you can see on the bottom of the screen, all you have to do in the chat, just put the word mouth. That's going to prompt you so that you'll have access to the show notes. And also, we have some really good giveaways, and I'll talk about those in a second. But let's get into the subject, pet dental care. So without any further ado, let me bring my guest in. And we're waiting for the magic of technology. Here we go. Hey, Benita, thank you so much for joining us today.
Hello, welcome, thank you.
Well, I'm really excited that you're here because it's true. Pet dental care is such a big subject. It's a very popular one, and there's so many products, there's so many procedures. And as a pet owner, for my cat or the dog, I'm not always sure what I should do. So tell us about you and what you do, because you teach around the world. I mean, you don't just teach veterinary technicians, you teach dentists, I mean, not dentists, but you teach veterinarians.
Yeah.
It's a big subject. There's a lot of education that's happening. So, and you've been doing this for 29 years yourself in practice in the past. You have a lot of experience. So tell us, how did
Right.
you get into this and what do you do?
Yeah, so thank you. Well, in the beginning, I wanted to be a veterinarian, and my high school advisor said I should maybe go to the technical school and become a technician first, just to make sure, because it was closer to home, less expensive. I was like, yeah, that sounds great. I'd known I wanted to be a veterinarian since I was a little kid. I had, a little farm growing up. We had Noah's Ark, two of every animal, and I was in 4-H, which really helped shape my life as well. Dog Project, Vet Science Project, and Horse Project, and just really always focused on caring for my animals. That was actually the thing I enjoyed the most, was kind of the daily care of these animals, and kind of the bond that I developed with the animals too really helped support my growth as a human being, I think. So I just realized how important animals were to me, and that obviously they were very important to other people. And I wanted to help other people take care of their pets and their animals. And I wound up getting my first job out of vet tech school, and stuck with it for now. It's been 32 years. I
Wow.
am not in practice now because I got my veterinary technician specialty in 2008. At that time, I was one of 23 people. So we are a really tight knit small group across the nation, and we've become an international academy. We have veterinary technician specialists in dentistry in countries like
Mm.
Australia and Scotland and Canada. And, I think it's a way that I've been able to advance my own career, and knowledge and expertise, and really become recognized for that. But definitely something that I think is important, because now I can go out and legitimately, really teach people, professionals, how to do dentistry properly, because it's a very little known fact, but veterinarians don't get hardly any dental education. They don't come out being dentists. They have often just had it as an elective procedure,
Mhm.
track, to learn about dental care and the procedures for oral surgery. So it's something we have to teach them after they graduate, and that's what I do full time now. I've been doing that full time for the last 4 years.
Well, the teaching 4 years, the actual practicing, you've done this for nearly 30 years. So when you're teaching, you have a
Yeah.
lot of experience. And I think you raised a really good point for the audience to know is that it's like if you have something going on with your mouth, you don't go to your general doctor, you go to an actual dentist. So
Yeah.
for a
Yeah,
veterinarian,
exactly.
it's for them to know everything is impossible. So when they have a
Yeah.
veterinary technician dentist expert in their team, then they technically have someone who really knows about the mouth and what steps and the procedures and so forth
Yeah,
that
a
allow
veterinary
them.
technician specialist can definitely add a lot to the practice. But, I actually began teaching in my own hospital before I even got my specialty, to be honest. I was
I see
always
that.
mentoring and teaching the other staff members too. And then after I got the specialty in 2008, I began teaching, but I didn't go full time with it and stop working in clinic because I enjoyed it. I enjoyed the whole idea of working with clients and the pets that we served. I was at my last hospital for 19 years, and I had a
Wow,
lot of
that's a
grandmas and grandpas that would give me great hugs and, just really appreciated, my care and attention to their pets that,
nice.
I definitely treat them like my own. So it's been an evolving process of going to teaching full time. But I feel like, I've been definitely teaching and mentoring, and I mentor other technicians who want to get their specialty as well.
So we're convinced dentistry is important. If you just joined us, we are with Benita Altier. She's a veterinary technician specializing in dentistry, and we're going to go into this whole subject of pet dental care. And let me start asking some very specific questions around this. So let's just ask the obvious questions. Why should I even be concerned about my pet's dental health? Beyond the marketing that we see out there, why is it that it matters?
Yeah, Olivia, thanks for asking. So, we kind of think about, our pets as family members, and I know human family members or animal family members that we all want the best for them. We want them to feel good. I'm really about supporting the human animal bond. And we can really do that through good health in general, but I kind of think about, a lot of people want to hug their pets. They want to get really close to their pets. They may allow their pets to lick their face,
Mhm.
and sleep in their bed. And honestly, it's one thing to think about, all that uh,
Wait, have you been at my house? Like
bacteria.
you describing my house or something?
Yeah.
Like that?
Yeah, even if a pet licks your skin, their tongue is covered in bacteria. And if they have poor oral health, I mean, that could make you want to kind of not allow your pet to get that close to you, which I think is sad. And that could definitely interrupt that really awesome human animal bond that I think is the essential part of why, humans can help animals, but animals help us a lot.
Mm, that's
And
true.
in order to, really strengthen that bond, oral health care needs to be a part of that to make sure that, our pet's as healthy as it can be and that they have a good quality of life and are not suffering with pain and infection that could definitely be prevented or for certain treated once it's recognized. So I think in most veterinary hospitals across the United States and Canada that I've been to, dental care is becoming one of the primary things that we talk about, things that we do. It's just that the education piece hasn't really caught up with the true demand. So that's why I play a role in educating the professionals to make sure that they're all on board with the proper care for these pets.
Yeah, it's interesting you say that because you and I have been to many different conferences, veterinary conference together, and veterinary dentistry conference like is going
Yeah,
on right now,
right
actually.
now. Yeah,
Vet
yeah, we're
Dental
having our big
Forum.
dental meeting this weekend.
That's right. And I think one of the key things to remember is that expertise also allows you to pay attention to the details of the discomfort that's created with, in oral health issues, which is the number one issue impacting cats and dogs. People forget that this is the biggest problem health-wise that affects them percentage-wise. 80% of cats and dogs by the age of 3 have some form of periodontal health issues or gum health issues. But what leads me to the next question that you can see on the screen right now is, most pets, they look fine. So like the technicians say, your your cat or your dog is in pain in the mouth. And it's like, really? So how do I know? I mean, can you shed some light on that? It's not to distrust the veterinarian, but it's also to understand more of why is it there's something I didn't see.
Yeah. Well, I think to start with, I think I've been out in the veterinary world for 32 years, and I can't think of one veterinarian or veterinary technician that did not really have your pet's interest at heart. This is not a profession where we make a lot of money. In fact, certainly as a vet tech, that's been a real struggle. And so it's not a profession that we're out looking to just spend your money or do something unnecessarily, because that is absolutely the last thing on our minds. And certainly is something that we take with definitely a very serious concern, that we would not recommend something with your pet, especially something as serious as going under general anesthesia without having, the proper reasons to do that. One thing I think we need to realize with animals is that it's their natural instinct to mask pain. And hunger and pain are two separate things. They're absolutely completely different in the mind of a dog or a cat. Um, I was, participating in an educational event, and we were kind of doing this role playing thing. And we had a veterinarian that was playing himself, and we had someone pretending to be a client. And the client said to him, my dog's eating just fine. I don't think his mouth is painful. Why are you telling me his mouth is painful? And the veterinarian said this very well to her. He said, ma'am, I understand that you don't really see this as painful, but your dog's going to continue to eat unless he'd rather die than eat. If the pain gets so bad that basically that negates that instinct to survive, then he's going to actually stop eating. And so this is something as an educator that we actually have to talk to the professionals about, because some of them don't necessarily believe that dental pain is there unless the pet has some serious anorexia or stops eating, or something worse, right? So it is definitely true that they will not stop eating, and that's not a sign of dental pain unless they have something significant like oral cancer or some other painful conditions of the mucosal tissues that are immune-mediated response conditions.
So what you're saying is, if oral pain becomes visible to a pet owner, it's probably a really bad situation. So
absolutely, yeah.
The proactiveness is quite important. Okay, so I think that's a really, really good point. And by the way, folks, as you're watching this live or in the future, if you hear anything that you're learning or that you want to share, definitely give us some pod loves. So if you just go into the notes and just put hashtag pod love, that enters you actually in a drawing that we do randomly, and we do it even in future viewing of this video. So you definitely, if you're watching this right now, go into the notes and just put hashtag pod love, and we do random drawings and give away some of our 1 TDC for gum health, actually, for the animals. So let's go into the next question also, in understanding some of the benefits. And you talked about anesthesia. I talked about that a little bit back. So what are the benefits and what are the risks of dental care performed under anesthesia? Can you demystify this anesthesia aspect of it? Because it scares a lot of people.
Yeah, sure. And sometimes people don't necessarily mention that they're afraid of anesthesia. Sometimes folks will, kind of back away from it using other things like, oh, it might be too expensive, or, I don't think this is really necessary. I've never had this done on my cat before. Why do I need to do this now? You've never said something to me before about my pet's mouth, so why is it now becoming a concern? So just different things like that. Sometimes people will say when they're really afraid that the pet might die under anesthesia. So the first thing
that is the concern. Are they going to wake up?
Yeah, oh, absolutely. The first thing I like to do is I like to explain that, veterinary medicine has come a really long way in the past 32 years since I became a technician in regards to how we can make sure the pet's actually healthy, their organ functions normal, and that there's nothing underlying going on that could put them at undue risk for us putting them under general anesthesia. And then on top of that, we really have better medications, better induction agents for the general anesthesia, very, very much better trained people to
Mhm.
monitor the anesthesia. You want to make sure someone's dedicated to monitoring the anesthesia on your pet while they're under anesthesia for anything, not just dentistry. And that should be a licensed veterinary technician under the supervision of a doctor. Because we want to make sure that the pet is monitored very carefully, and that's standard of care, but it's not done everywhere. So that's some questions you really need to ask. Who's actually monitoring my pet while it's under anesthesia? Are they dedicated to that, or are they trying to do three things at once? And not really paying attention to the pet under anesthesia. And then on top
Actually,
of that, the death rate
slow
is
down on
very,
this
very,
one.
very low.
So,
So.
sorry to interrupt you. This is a
Oh,
really
no.
important part, what you just said. And I just want to take a second because when we're afraid of anesthesia, we should, because it's a calculated poison, but it's done by experts. And I think the huge one that anyone can ask is there somebody else monitoring, just monitoring that machine for my cat or my dog that's under anesthesia? And the truth is, if you don't have that, that means, like you said, if I'm doing a procedure, I've got other things going on. Nobody has, it's like when we go under anesthesia, there's an anesthesiologist, there's somebody
Yeah.
dedicated, and there's no
Right.
reason why it shouldn't be the same for your pet. Now, some places you may not have access to that, but you should ask and
Yes.
then feel comfortable or uncomfortable to take that next step. But I can tell you that from the learning that I've had from you and many of your peers is I would never let my cat or my dog under anesthesia unless there was somebody dedicated actually
Yes.
monitoring that machine. So from a safety standpoint, folks, if that's one of your fears, ask that question. If they don't, you may want to rethink if you want the procedure done.
Yeah, no, absolutely. Because I think as we become more educated pet parents, and, I'm a pet parent as well, and, I know the right questions to ask, but I think the general public doesn't. And honestly, we're not really monitoring the machine that's hooked up to the pet. We're actually monitoring the pet. The
That's right.
machine is just a tool that we
Good
use
point.
to make sure that we can monitor certain parameters and look for trends or changes. Usually, we're looking for things like their blood pressure. We also want to make sure that their heart rhythm is correct, and electrical activity and all of that. But also keeping the pets warm too. That's something that a lot of hospitals maybe don't do very well. And so that's a question you can ask, like, what measures do you use to keep my pet warm while they're under anesthesia? Because if the pet
Great
loses
point.
body heat, that can be very detrimental to their well-being under anesthesia, and also recovery and healing from procedures. And that
Great
goes
point.
for any kind of procedure, not just dentistry. But dentistry tends to be a long procedure, and certainly the pet's mouth is a place they can lose heat. And we tend to have to use water around the mouth, which can precipitate more heat loss. So, keeping the pet warm is an extreme concern. So
That's
that's something to ask.
That's a great point. If you've just joined us, we are here with Benita Altier. She is a veterinary technician specializing in dentistry, and she's answering some great questions. We just covered anesthesia. If you've missed it, don't worry, because we're going to have show notes. All you have to go is in our current chat and put the word mouth, and then you'll get access to that. Whether you're watching live or in the future, this will still give you access to that here on Facebook. Let's go into the next question and really understand the frequency of treatments, specifically when we talk about anesthesia, putting your animal under anesthesia. So how often should you do dental care, and why?
Yeah. So, if you wouldn't mind, I'd like to go back just to talk about a couple of the benefits. Like, why should we go actually put this pet under anesthesia in the first place, right?
Please.
So the first reason is because we need to look in deeper. If we just look at the surface of the teeth on the awake patient, we are
Mhm.
only seeing at best probably 25% of the teeth in the mouth, because you
Mhm.
might not know this, but your dog has 42 teeth and cats have 30 teeth, and they go way back there, and they're very large roots. And
Yes,
so if we could
they're
see,
huge.
yeah, if we could see all of the crown, we're only seeing 40%. But when we look on an awake patient, we can't even see all of the crown. So think about the part of the tooth you can see, the part you can brush. That's the tip of the iceberg. So 60% are these giant roots. And then even more importantly is the bone surrounding the teeth, because
Mhm.
the loss of bone, that's periodontal disease. You may have heard of that. It's subsequent after we start to even get a little bit of gingivitis. Things progress to the fact that we're starting to lose bone, which we can never get back. And so I like to describe that as the house the tooth is living in, the house of the tooth that it's falling apart, the walls are crumbling, we've got, a serious problem going on. Pretty soon the tooth can't live there anymore. And that's when we start to get deep set infection. So the benefits of putting a pet under anesthesia are not about cleaning the teeth, really. It's really about making sure that we investigate further, which is to do full mouth dental radiographs, because that's the only way we can actually assess the bone around the teeth. And again, that's usually where the disease lies. And then the tooth roots themselves, because that's completely hidden. I always like to tell
Mhm.
clients, I didn't get x-ray vision with my education, neither did my doctors. And so we need to look in deeper, so similar to doing blood testing or any other testing, we're not just looking at the pet on the outside and maybe taking some vital signs. Like, no, we need to look in deeper. And then that first time we do that, we're actually establishing a baseline of care, seeing if there's anything that's different about the way the teeth developed, if there's any
Mhm.
teeth that didn't erupt, if there's anything specific that we can recognize and treat now, which unfortunately most pets come to us with disease that needs to be treated, a high percentage. It's very rare that we don't find anything if we're actually looking, because that's being proper, thorough medicine. And so our goal is really to make sure your pet goes home with any disease treated, stabilized, and you have a plan so that you can help us help your pet between our professional visits where they go under anesthesia again, which kind of brings me to this, well, when should we repeat this, right? So we've done this first procedure, and we like to call it a core procedure, which core dentistry is comprehensive oral and radiographic evaluation. And of course, we're going to make the mouth a cleaner place, right? So we're going to do that. And then if they need to have any oral surgery, which is extractions or other things done, of course, we're going to take care of that for them. We don't want to anesthetize them multiple times if we can help it. So it's usually, hopefully, a one-step procedure, but sometimes pets have so much disease that we have to do it in 2 anesthetic visits. So if your vet's telling you it's a 2-step procedure, I mean, that makes sense. We don't want to keep them under for hours and hours, which could potentially put them at a higher risk for losing body heat and blood pressure and things like that.
That- that- that-
Generally speaking, it's an annual procedure.
Annual. And that's a good point. And the irony of you and I connecting today is yesterday, guess where I was? I was at the dentist.
Oh, you're for
And
yourself? Okay.
yeah, and they stress every 6 months, or in my case, it's once a year or sometimes less. But what's the
Yeah.
first thing they do? To your point, they didn't just look at my smile. They basically said, let's get some x-rays done. And that's the first thing that they did. So there really is no difference in assessing our quality of mouth. If you don't do a dental x-ray, you don't have, to your point, you're seeing very little of the
Yeah.
potential pain that your pet might be enduring. So
Yeah.
I'm
And it
happy to
never
report
gets
everything
better
went
than it
well.
is today. So it's good that you did that, because then you get reminded, oh yeah, I should floss, and I should do these things. And our pets aren't often getting that kind of home care that we'd hopefully do for ourselves.
That's right.
But definitely, that first baseline dental procedure can really get you off on the right foot to make sure that number one, that the pet's mouth is now not in pain, not infected, not having a severe problem like a broken tooth or a dead tooth. There's different things, that could be really extensively painful and put them at
Right.
risk for something more serious. And we screen for oral cancers. We're looking in the mouth, making sure there's no any sign of any gross or cancerous things that would be concerning. And catching those early could save your pet's life. And so it's not something we can do on an awake patient. Otherwise, you probably were pretty cooperative, I bet. You didn't
I
bite
didn't bite
anyone.
anyone.
Good.
So let me ask you, because when you mentioned that, what kind of goes through people's mind is, hey, my dog is fine. I get it. They could be in pain and they're hiding. I get that. But there's
Yeah.
also, is there anything specific to breeds?
Yeah.
I've heard folks talk a lot about that when you're teaching the vet techs or you're teaching the dentists of, hey, you've got a Sheltie. I'll let you talk about it. So what are the breed specific we should be aware of that have more
Sure.
likely issues?
Yeah, so there's so many breeds out there now. I don't think I even know them all. I used to pride myself on knowing them all, but there's just so many now. I can't keep up with it. But we're going to kind of break them down into basic skull types because that can make a difference. So we have dogs that are kind of in wolf-like form where they have a fairly long nose, and I will tell you, every dog breed has 42 teeth if they have all their adult teeth. So
Okay.
there's no difference between, the Sheltie that you mentioned, the Great Dane, or the little Chihuahua. So they all have 42 teeth. Now, it does make sense that in a bigger dog, the teeth are going to be larger in structure, and there's going to be more bone surrounding those teeth as well. But breed specific, we have, created these breeds that have very short faces. Frenchies are very popular, Boston
Mm-hmm.
Terriers, pugs,
Mm-hmm.
Shih Tzus, all sorts of these breeds that, although their face is very cute, one thing I like to tell their pet parents is that just so you know, they're going to have as many teeth as a German Shepherd, but they're not all going to fit in there. There's going to be some issues, right? And so as these teeth come in, the adult teeth come in, the baby teeth fall out, we often see some issue with crowded teeth, rotated teeth, teeth that don't erupt, as well as teeth that are actually causing trauma or poking into the roof of the mouth or poking into another tooth where they can't even close their mouth properly. And that can be really painful. And I will tell you, your dog is never going to tell you that's happening. They might be very head shy. They definitely might not want you to look in there, which for good reason, it's not comfortable, right? But it's something that we really expect. And if it doesn't happen in those what we call brachycephalic breeds, or the breeds that have the short faces, we will definitely want to address that when they're puppies, as they get their adult teeth in. So usually between 4 and 6 months of age is a very critical time for these young patients. And cats the same. These cats that have a shorter maxilla and mandible, which is their upper jaw, lower jaw, we see some problems with soft tissue being traumatized by teeth, which can be really painful and can cause some significant problems, as well as things like the teeth that don't erupt or they erupt in the wrong place. So those are the most risk, but there are other dental conditions that have been shown to be more breed specific, like boxers getting overgrowth of gum tissue that basically is covering their teeth. So that's one that a lot of people may have heard of if you're a boxer fan. Yeah. So definitely, I think your vet should make you aware of different breed specific concerns.
Excellent. Now that's a lot of great information. If you've just joined us, we are with Benita Altier, and she is an expert as a veterinary technician specializing in dentistry and answering some really great questions for us. Okay, here's my next question for you. So I do the procedure. My cat, my dog is recovering. What should I expect in that recovery and from the procedure? What do I do next? And what should I expect in that moment?
Yeah, I think a lot of people worry about their pet, coming home from having anesthesia and, how are they going to be? Are they going to be able to eat, especially if they've had to have some extractions? We often have people ask, is my pet going to be able to eat? And honestly, dogs and cats can eat with no teeth, but that is absolutely not our goal. We want them to have their adult teeth throughout their whole entire life. We want their mouth to be healthy. We want them to keep their teeth. It's definitely not something we strive to do, is to have to extract teeth. So that is, if your vet is telling you that a tooth has to be extracted, I'm telling you they are telling you that because there's no other choice. It's not something that we would ever tell someone to do if it wasn't important.
That's
And
important
we
you say
want
that.
to make sure, yeah, it's sometimes, the pet parents, I understand, are a little apprehensive about their pet having to lose some teeth,
Mm,
but we don't want to leave infected, painful teeth in there. And it sometimes gets to the place where we have no choice.
got it.
But as far as, pain management, just like when you go to the dentist, they actually do nerve blocks, which basically make your mouth all numb and tingly as that wears off. And your veterinarian should do that as well. So that's a great question to ask. Are they actually going to do nerve blocks if there's extractions? Now, if there isn't any extractions, sometimes there's procedures that we do them for anyway, but if it was just a cleaning, there probably won't be nerve blocks. But if there were
Got it.
extractions or some tooth saving procedures, then sometimes, I mean, all the time we're going to do nerve blocks. But make sure you ask if that's the case with your veterinarian. So again, you becoming more educated to ask the right questions. And as that wears off, they're going to give you some pain medication to give them at home if they've had something painful done. Generally speaking, though, animals don't know what we did. They were just, awake, and then they were asleep, and then they're awake again. And I'm sure that time went by in an instant for them, and they just want to get back to doing their normal stuff. So, they may feel a little groggy, which is actually good. We want them to rest and not be pacing or anxious or things like that. But different anesthetic drugs and different pets can react a little differently. It doesn't mean that something's particularly wrong. It just means that maybe they'll use a different medication next time for your pet if they do have some sort of a restless anxiety after anesthesia for a few hours.
Got
But
it.
after that, usually the next day, they act like nothing happened, even if they had a lot of extractions. And we have them feed softer food for a
Hmm.
week or two, depending. And best thing about my job is when the pet parents bring them back to us for their follow-up visit, because we always do
Okay.
follow-up visit. And they tell us that they had no idea their pet was suffering and that they're acting like a puppy or kitten again, or we gave them a new dog, or now the cat's not sleeping all the time. He's actually coming out and he wants treats, and he's trying to play with his balls again and stuff that he was playing with when he was younger. So I think that's the best thing about it, is that there is a definite difference between this chronic condition that led them to a bad place and something that we can see a dramatic change once we treat the disease.
And the truth is, if you have your veterinarian or the technician do the proper evaluation, you'll know. You'll know there's
Yes.
something, or there's nothing, and you're doing a
Yeah.
great job. So there's this element of reassurance as well. But you're right. I've heard so many stories by Dr. Anthony, as you know, who's a chief medical
Yeah.
officer as a veterinary dentist, how often he has had patients in the recheck like you're describing, and they come back and they say, I have a different dog, I have a different cat, the behaviors change.
Yeah.
And often, people, we can feel so guilty because we didn't actually realize that my cat or dog was actually not feeling well. So there's a bit of a guilt, and it's not to for us to feel guilty, not to be in fear. It's more like, what? Let's get a proper evaluation with a place that has a dental X-ray machine. That's another one to check on. They have someone,
Yes.
monitoring the patients when they under and so forth. Okay, this is a great point. Okay, so let me ask you along those lines, when it comes to what is recommended from a pet dental care at home, what are some of the things that's recommended and things that we should avoid? Because
Oh, okay.
to your point, like the cat or the dog, they get back home, I want to eat, I want to play with a frisbee, I'm ready to rock and roll. So
Right,
is
right.
there things that we should proactively expect to be told, or you can tell us now?
Yeah, so especially at the follow-up visit, that's when we really start talking to you about what to do at home between our professional core dental procedures. Definitely what you do at home is probably 70% of this, because it's a day-to-day thing. And honestly, the best dental care is something that you'll actually do, because I could tell you to do so many different things, but if
Mhm.
you're not willing to do it, or you're not willing to be patient as you adopt a new habit, because a lot of times we're training you. Yeah, I'm talking about you, the pet parent, right there. We're not training your pet, we're training you
That's
to
true.
actually start the process to get a habit going. And so if it's something that you think you are willing to do, I think that's the best option. And there's certain things that are gold standard options and different things, but I think you have to decide your level of commitment. And then also, we need to have a pet that we know the mouth is not painful. So
Mhm.
I don't recommend, having people starting to do toothbrushing if we've never done the core dental procedure. For the most part, even with some younger pets, because younger pets can have painful things we don't know about. So ideally, once we do that first core dental procedure, you're going to know better. But introducing that to the young pet is very important. Toothbrushing, gold standard. So I'm sure your dentist, hygienist reminded you, this is something that we do twice a day, hopefully, and we have some pretty fancy Sonicare and different types of toothbrushes, right? So we can be pretty invasive on our own mouths to make sure that we're doing the best job of dental hygiene. With pets, it's a little bit more tricky to introduce that to them. So there is definitely a good way to go about it, and maybe a way that would scare them, and it would be difficult to gain their trust and get your results you're looking for. So I know you have a video on how to brush your dog's teeth. So
We
I mean,
do.
there's some good information. Yeah.
I'll put
So
that in the
it,
notes for you guys. But yeah,
yeah,
you're right. There are steps to it. Some animals will be a lot faster than others. We need to do the one on the cat specifically. We'll probably do that with one of our
yeah,
good friend that's an expert in cat world. But yeah, there are steps to it
yeah.
for sure.
So brushing, if that's what you're willing to commit to, and we're going to, learn it's a process to get that habit going for yourself in your daily routine, and also your pet accepting that. That definitely is all our number one recommendation. It has to be done daily. If you try to think you're going to do it every other day or once a week, it's just not going to work. So daily toothbrushing. And if you want to even do it twice a day, more power to you. And I have seen clients who have done that, and I have been absolutely amazed at how healthy they're able to keep that pet's mouth once we confirm it's healthy with that baseline care of the core dental procedure. Um, the next category of things I think are a little less hands on, whereas we can talk about things that you can offer the pet in the way of foods and treats and chews and even different toys. And you mentioned about things that we don't want to give our pets. So things that will damage the teeth, those things can cause your pet to have significant tooth damage, which could lead to infected teeth, dead teeth. And so those things are things that they could break a tooth on, and anything that's basically hard, like real bones, antlers, nylon chew toys, cow hooves, a lot of products that come from another animal. Those things are so hard. And dogs, one thing to remember, they have really strong bite power, and they will try to break the object, and then the tooth breaks. And once a tooth breaks, it's exposed the nerve, and the inside of the tooth is acutely painful, and it's open
Mhm.
for bacteria to create a significant infection and the death of the tooth. And we don't want that for your pet. So even though there's things in the pet stores that look enticing, or you think, wow, this will entertain the dog for a few hours and it won't ever break down, those things are really dangerous for teeth. And then also things that have really abrasive fabrics, like tennis balls. I know everybody thinks tennis
Mhm.
balls are dog's best friend, but that fabric is so abrasive. And the enamel in dogs' teeth is actually less than humans by half. And so it doesn't take much abrasive action from a tennis ball to wear the enamel away, and it'll be gone for good. Enamel never grows back. And that exposes the softer inner layer of the tooth, which is porous, and bacteria can get inside the tooth that way too. And if the wear is significant enough, it certainly can cause the death of the tooth as well. So anything like that,
Mhm.
we kind of want to stay away from. And then,
So you
go
wait,
ahead.
hold on. You're giving a lot of nuggets here and information.
Yeah.
So just join in, folks. There's a lot that Benita Altier just shared with us, and I think what struck my attention, what you said, is about the hardness of what we give our dog. And you mentioned antlers, and the fact is there's salt in there, and the dogs, generally more than cats, the dogs really love the taste and they'll chew on it. And the common question that I get is, well, in the wild, they don't say, oh, it's too hard, I'm going to break my teeth. They do that. So why should I really be that concerned?
Yeah, actually, dogs in the wild don't chew on antlers. They would never do that. Like
Good point.
that gets left behind. They obviously, when an animal kills prey, that's a fresh kill, and they would go for organ meats first. And depending on in the pack, if we're talking about a pack of wolves here, or even a pack of lions, they're going to go for the most nutrient dense materials, and they're not bored. Animals in the wild are not sitting around chewing on things out of boredom. That's unfortunately something that our pets, they just don't have enough enrichment in their daily lives sometimes, and they do have a need to chew things, and also I think the food that we give them doesn't satisfy that natural instinct to
Mm,
chew things. And bones from a recently killed animal are not the same as the bones at the store that have been basically dry.
mm,
And that dry bone actually can splinter into the intestines and cause some pretty severe gastric or intestinal lacerations. And in working in the vet profession, I've seen dogs have to lose more than half of their intestinal tract because of chewing on bones. So, um, not to mention just the breakage of the teeth. So I think, and dogs in the wild break their teeth. And if a dog in the wild gets a tooth abscess, they are definitely going to perish because they're not going to be fed. They certainly would,
mm.
succumb to that infection. So I think that the people that think, wild dogs are superior and that they don't break teeth or that they would sit around chewing on an antler, it's just not true. Just that
Mm.
doesn't happen.
So on that note, to your point, then, because I mean, it is a bit controversial. A lot of us have this instinct that I want to give a bone and so forth. So one of the things I've learned from you in the world of dentistry for the pets is if you can't bend it, you shouldn't
Yes.
give it. So
Yes.
on that note, is there any specific products that you would recommend? Say, you know what, that's safe. That is something that you can give and not have a second thought in that not being detrimental to you oral health of your
Yeah.
pet.
So, as veterinary professionals, and when I go out and teach them this too, we recommend that they explore the Veterinary Oral Health Council website. That's the vohc.org. And
Absolutely.
on there, they actually have a PDF file of all the products that have had the seal of approval for plaque or tartar prevention,
Excellent.
as well as for cats. So you can read about it there. And anything with that seal on it has had third party testing to submit those results to the Oral Health Council to basically confirm that these products are effective. Now, there are other products out there that I'm assuming are effective, but they just haven't done the proper testing to submit those results to the Oral Health Council to get that seal. But we definitely feel really good about recommending things on there. Now,
Excellent.
there's dental diets, there's chews, there's even a toothpaste. There's different things on there, so you have multiple things to pick from. There's an oral water additive, and some other things. So I think that's definitely worth exploring, and just using some common sense with any kind of toys or chew objects, like you mentioned. They kind of need to be able to bend them or dent them in with a fingernail. They're not going to be something that's going to be this one-time purchase that's going to last for the whole dog's life. Now,
Mm,
there's some dogs that just don't voraciously chew at things, but unfortunately, that's the primary cause of tooth fractures. It's not dogs finding something out there in the yard that they chew on that breaks the tooth. It's things we buy with our good money and we give them, and that leads to us extracting the tooth. They'll never have that tooth again, and it's probably going to be a big important
mm.
tooth, or the tooth has to have a very expensive root canal procedure. So
Oof,
none of that
not
is
fun.
good, and we want to prevent that. And then lastly, just making sure that you supervise the pet.
Although,
Cats don't tend to chew on things, but anything you give the dog, don't just give it and walk away, because
right.
some dogs will try to swallow things whole. And we certainly see, exploratory surgeries have to happen to remove things from the stomach or intestines because the dog was left unsupervised or got into something that they shouldn't.
Yeah, and the one thing, that made me laugh when you said it's usually what we buy expensive stuff. I do know that there are some dogs. Some of my friends, we have some pretty wild dogs that like to chew on rocks. So there's a little bit of everything. You should definitely supervise as best as you
There
can.
are rock
Yeah.
chewers, and that's hard because those things are out there, and that's, something they can try to get without us knowing about it. So
Wood.
that's
Yep.
absolutely true. Rock chewers, and dogs just need some enrichment to prevent them from wanting to get into a habit of trying to pick up rocks and chew them or swallow them.
So the important part is in the VOHC, and we'll have this in the show notes. We'll put the links for you folks. So make sure that you go down in our current notes here and just put the word mouth. You'll get access to all of that, including actually a fantastic oral health guide for cats and for dogs. We have one of each. It's a 42-page ebook. It's free, so you might as well go in there at any time as you're watching this video, put the word mouth, and you'll get access to that. About VOHC, one of the things I was going to share as well is they specialize in tartar and plaque
Right.
analysis. And as you know, with one TDC, which is a gum health product, they can't certify it because it's about gum health, which is
Yes.
it's obviously
Well,
not something.
actually, people think tartar and plaque is the enemy. Plaque itself is what we wake up with. Dr. Cindy Charlier, who I adore and teach with her a lot. She's a veterinary dentist. She says it's the socks that are on our teeth when we wake up. It's that sock on there. We got to brush that off, right? Um, that contains bacteria, which, if left unchecked, could certainly move into more serious pathogens that can live without oxygen.
That's
However,
right.
the tartar itself isn't really an issue. What really we want to protect is honestly the gum health. So to your point, it's the gum health we want to protect. And so, even though one TDC can't maybe get that VOHC seal because of its focus on plaque or tartar prevention, I think the real focus has to be on preventing gingivitis, because that's the first stage of periodontal disease and the only reversible stage. And once we get past that stage, then we already start to get bone loss. So if we can just prevent that gingivitis through all the steps that we were talking about, but incorporating the one TDC into our daily routine, and preventing that from becoming a serious issue, I think we are way ahead of the game. So, one TDC came into my life. I think it's been maybe 15 years ago. In fact, I don't think it was called that then. I think it had a different name, right? And I actually learned about it working with a veterinary dentist, and she was, recommending it to the patients. And I just was really impressed. And so that's why, I definitely would stand behind that product as being an adjunctive method that we can use to really help focus on that gum health and make sure that we don't lose control there, because that's really where the inflammation is, which inflammation leads to bone loss, which eventually leads to that house crumbling, as I mentioned, where,
Mhm.
the tooth can't live there anymore. And we don't want that. So, prevention is key. And I think one TDC can be a huge part of that preventative routine. And honestly, the benefit of the joints. I mean, one thing that I know as I get older, like we want to keep our teeth healthy and we want to keep our joints healthy. We enjoy eating and we want to keep our mouth looking good. And then also we want to be able to have mobility. And so the joint factor with the one TDC, I think, is a beautiful combination with the periodontal health idea too.
Excellent. Well, and in your case, you're constantly with veterinary dentists and
Yeah.
specialists like yourself. So you guys have put it through the ringer. So when you say that, it means a lot because it's been used quite a bit
Yeah, and
in
for
the
my own
field.
my own cat too. I don't have a dog now. I have a cat, but I he's going to be 9, and I want him to have, very healthy mouth and reduced risk of periodontal disease as well as joint health as he ages. So definitely believe in it for my own pet as well.
Well, thank you for that. Yeah, we do pride ourselves to really be able to help those pets feel their best
Yeah.
in their mouth with one teeth and keeping those gums looking really healthy. Well, that leads nicely to one key question for you. So, if you had to narrow it down when it comes to oral home care solutions, because to your point, it what matters is what you can actually do following up procedures at home. But if you had to narrow it down to the top three care solutions that you said, this would be your takeaways at the top three oral home care, what would that be?
Yeah, so I think number one, I would explore a food that has a dental benefit because your pet has to eat. So, how easy is that, right? And the foods that have dental benefits, you can look for that VOHC seal. You can look on the VOHC website. Those have been proven to actually be effective at plaque or tartar control or both. Because our pets need to eat, I think that's a no-brainer. So, explore a food option. My own cat eats a dental diet. That's all he eats, and he's going to get his core procedure every year, and we're going to take care of his mouth the best we can. He doesn't love toothbrushing, but we try. And secondly, explore things that your pet would like as a treat or a
Mhm.
chew object that's not going to damage the teeth. And I know they're making some really nice enrichment dental objects now where they can play with that for a while, and it can actually maybe have a mechanical removal of plaque on the teeth while they're playing with the toy, and it can be sort of impregnated with different little treats or different things you can put in little notches and things that can kind of help entertain them, and they can't just get the treats quickly. So
Excellent.
I would explore what you think would be safe for your pet and something you would feel good about giving them, and that something is going to be having a dental benefit. And then lastly, I think the one TDC, as I mentioned, because the gingivitis is so incredibly detrimental to the
Mm.
bone and the inflammatory process that causes that bone loss. I would definitely focus on something like that because it's so easy, and the pets really like it, and so it
Mm.
makes it really easy to do that. Of course, I said gold standard toothbrushing, and we can definitely talk about that. But I think if we want to talk about something that you will do, and that's something that you will be able to even start doing today, those would kind of be my top three things.
Got it. Now that's really good insights. And to your point, the way we explain it is with the one TDC for the mouth, or for the rest of the body for that matter, it really promotes healthy inflammatory responses, and it's all about making sure that they feel their best
Right.
and bring back some of that behavior, being a little bit friendly sometimes because they are in discomfort. So if we can help with the discomfort part, either orthopedically or here our main topic, the mouth, then that's what
Yeah.
makes us really happy. Good. So
Yeah.
we've
Like
covered. Go ahead.
oh, I was just going to say, like with the joint health, like your dog has a, cruciate ligament injury. You
Mhm.
definitely can't just, explore palliative care at home versus getting surgery if what they really need is surgery. So I think
Right.
that can draw a similar conclusion. But then post surgically, like, how are we going to do this? How are we going to prevent this from happening in the other knee? And what's going to go on there? I think that's all something that could be related with dental care. Like, how do we prevent more tooth loss? How do we prevent more inflammation? How do we do all those things?
Absolutely. All right. So this was your last question. So what we're going to do now, we're going to do a recap of your top five. So I'm going to hide you for a second, and I'm going to
Okay.
bring you back so I can reintroduce the topic. For those of you just joined, hey, stick with us. We're about to do a complete recap right now with Benita Altier. So hold on a second. I'm going to hide you and bring you back. So here we go. All right, everyone, if you just joined us, here's the deal. We're about to learn all about pet dental care. The reality is, a healthy mouth is the gateway to a healthy body, but what should I do? And what are the top five top tips that I could learn on being better with my cat and my dog? Well, I've got a treat for you. I've got Benita Altier. She's an expert in veterinary dentistry as a technician who specialized in it. There's less than 100 of them in the world, and she's about to give you the top five tips. So here we go. Let me bring Benita on here. Here we go. Benita, here you come. 1, 2, 3. Hey, welcome.
Hey, thank you.
So, pet dental care, you're an expert in the subject. We want to kind of get to the bottom line. Like, if you were to give me the top 5 tips, what should I really know? Tip number 1, what do I need to know about pet dental care?
So, veterinary care for dentistry is essential for your pet throughout their life, starting at a very young age before they
Mm,
even get their adult teeth in. So, this is a lifelong pursuit. It's not something we want to wait till disease is present and then have this horrible pain and infection we have to treat. So, talk with your veterinarian and get a plan. Start young when you get that new puppy or kitten, and really get a plan, ask the right questions, and make it a lifelong pursuit because we want to strengthen the human animal bond. We want them to have a good quality of life, and we want to make sure that they can be happy and healthy throughout that time. So that's my first
excellent.
tip: is make it important and ask the right questions.
Perfect. That was tip number 1, folks, in pet dental care. All right, let's go to tip number 2.
So, what you do for your pet at home, as far as home care to prevent gingivitis, prevent the accumulation of plaque, which contains bacteria that can be really harmful to the surrounding supportive structures of the tooth, such as the bone and the gums. I think that's the real thing that we need to focus on. And that has to be a daily routine as
Mm,
well as having annual professional care, so that we can make sure that what you're doing at home is effective, and picking some things that you will do, very important, so that we can establish a daily routine of oral health care for our dog or our cat.
got it. And as you well know, if you watch this interview with Benita Altier, 1 TDC is definitely the easy one. It's very tasty and it's very easy to do. And
Yeah,
if you keep,
even for my cat, like he likes it. So
yeah, some pets love it.
definitely, yeah, yes. And cats, they're the true test. They they know they're very finicky, as you know about cats.
But cats can like something one day and not the other day. So,
It is true. It is
right.
true. Yep.
Yeah. All right. So that was tip number 2. What you do at home is the key. Now, tip number 3 about pet dental care. What should we know?
So, professional care is really essential because, as I mentioned earlier, if we just look at the mouth with the patient or pet awake, we're only seeing maybe about 25% of the tooth surface. And 40% of the tooth is the crown of the tooth, the part that we can see, the part that's covered with enamel. So, dogs and cats, they have a lot of teeth, 42 teeth in the dog, 30 in the cat. There's just no way in an awake patient that we can examine all those surfaces
Mm,
properly. Like when you go to the dentist and they probe around for pockets and look at your teeth, animals are not going to let us do that effectively. And then, even more importantly, is that the 60% of the tooth is the root. And
mm,
even more important than the root itself is the bone surrounding it, because that's the house the tooth's living in. So, we have to take full mouth dental x-rays, which is required to be done under general anesthesia, so we can make sure your pet's safe and that we can do this properly. That's absolutely required. And we want to do that on some sort of routine basis. Once we do that first, what we call core dental procedure, which we recommend about 18 months of age if they haven't had it done earlier than that, and then annually after that for most pets. Some of them have to have it more frequent, especially if disease is already progressed and we're trying to save teeth. So,
got it.
professional care is, without exception, the foundation for oral health.
Excellent. Be proactive. Get a good examination so you know where you're
Exactly.
excellent.
Yeah, and ask the
Um,
right questions of your vet.
that's right. Yeah,
Yeah.
we talked about that. Monitoring dental X-ray machines, all of those
Yes.
details, they're not all created equal. All
No,
right,
they are
so
not.
pet tip number 4 for pet dental care.
Yeah, so we want to have a goal of maintaining dental health. We don't want to let it become a problem before we address it. So a
Mm,
lot of people think, oh, the vet said the dog's teeth or the cat's teeth look really clean. Maybe we don't need to do anything, and that's really not true. The first time that we take dental x-rays, we're actually just getting a baseline. We're assessing all of the bone, we're assessing all of the teeth. There can be developmental abnormalities like teeth that don't grow right or teeth that don't erupt, and those can be very detrimental to the pet's health, and something that we would want to take care of, and not just let it sit there and fester and become a big issue that could be potentially causing us to have to extract teeth or have the pet go through a pretty extensive surgery. So we want to make sure to be having that goal of ensuring everything is normal, establishing a baseline of care through our veterinarians work and the x-rays and everything, and then how are we going to do that moving forward with our home care routine. So we talked about that, and definitely preventing the concern with the inflammatory response, that gingivitis that leads to more significant periodontal disease. And again, the one TDC is a great option to incorporate into our program of home care, along with the other things we talked about, like daily toothbrushing and treats and diets and chews and stuff.
Excellent. Proactiveness, again, I hear that reoccurring theme. All right, last tip for us on pet dental care. What should we know?
So there's definitely some specific safe foods and treats and chews and supplements, and we touched upon a lot of that. I think the main thing is to avoid giving your pet, especially dogs who have a lot of bite power, things that may really damage their teeth, causing irreparable damage to the point that, we have significant acute pain, which can lead to tooth death, and of course lead to infection in the bone surrounding a dead tooth, and definitely lead to some pretty serious suffering. So we don't want to do any of that kind of thing. Our pets really need to have teeth, if at all possible, that are healthy and not painful. And then, really just thinking about how you can become more educated along the lines of understanding what professional dental care should be. Also, there's a document online too, which any pet owner can get a hold of. It's the American Animal Hospital Association. That's a hospital association that kind of exemplifies the highest standards of care and the hospitals across the United States. I've always worked for American Animal Hospital Association certified practices, and it really is important. There's a lot of things in there. And there's a 2019 update to the dental guidelines. And as a pet owner, I think that that's something great that you should read through, because it really does help you understand better the questions you should be asking your veterinarian, and finding out more so that you can really go to a hospital that aligns with your personal ideas on standard of care and safety for your pet.
It's a very hard certification to get, and they have to renew it.
It is.
So that's a really good point.
Yeah. And the American Veterinary Dental College website's a great place. They do have resources there for pet parents too. So it's not just for veterinary professionals. And that's a great resource, because we don't want to just Google something. Sometimes it takes us kind of down a rabbit hole, but definitely looking into more professional organizations that represent professional veterinary care and dentistry, specifically if that's what your concern is.
Excellent. Well, we thank you for the top 5 tips in pet dental care. Benita, you've been a wonderful guest. I really thank you for giving us all this information. There's a lot that was covered on this show. If you're still watching this live, make sure that you go into the notes and put the word mouth. You'll get access to some giveaways of the one TDC. There's also a wonderful, wonderful ebook, both for cats and for dogs. It's a free ebook. You'll get access to that as well. So it'll cover some of the topics that Benita talked about. And in addition to that, you'll get actually the recap of everything. So you'll get all of that accessible for you.
That's great. Really Thanks for all the resources.
Well, it's in really, and I know that's your passion. It's about education. Yeah. So it's a journey. It's like, what do I need to do? Well, hopefully this video was able to help folks understand that and then maybe more questions in the future. So if you're watching this and you're here at the end and you got more questions, inside of the show notes, you'll have access to Benita, and she'll be able to you get the links where you can actually ask your questions. So you definitely want to take advantage of that. Thank you for your time. I know it's actually a really busy weekend with the dental forum going on right now for veterinarians.
Yeah, so I'm going to get on and get educated myself. So
that's right.
I'm always learning, and please feel free to reach out to me with questions. I am very happy to help any of you if you have questions about how to seek professional dental care for your pet.
We appreciate you, and we'll have you on again. Thank you so much, and have a
Oh, thank
wonderful
you.
rest of the weekend.